the biggest challenge is identifying data or biomarkers are, potential false positives. So, for example, you have a group of 50 men that you look at, and you do a screen looking for, which markers are differentially expressed, and while they may correlate in a smaller group, as you get to a larger group of patients that you're really looking to assess, they may not end up panning out as correlating in that larger group of patients. And then the other thing is, when you're doing this broad omics, I say omics as the suffix, whether it's proteomics, genomics, metabolomics, these large sort of omics-based studies, you get a huge amount of data, and you get a huge number of proteins or genes or metabolites that may be of significance, and it takes a lot of time and effort to look at each individual one. And I think that's the biggest challenge. It takes a significant amount of time. And then the real question, if you find something, and when you find something that correlates with, whether it's Gleason score or whether it's disease outcome, what does that mean clinically, and how does that compare with the standard parameters that we have? And so that's the challenge with biomarkers. We see a ton of research on biomarkers, and it's the number that have truly affected clinical care, compared to all of the research and all the publications we see, is quite small. And I think there are many of us who still hold hope that they'll hopefully, there are some that will positively affect care, and so that's why we keep moving forward and persevering in what we do. But there certainly are challenges in doing it.